Welcome back to my channel. Let's look at the sacral plexus. The sacral plexus is a collection of nerves seen around the posterolateral part of the pelvic cavity. Let's use this image by the side here for illustration. This is where we have the pelvic cavity, and on the posterolateral part of this region, we have nerves coming together to form the sacral plexus. Branches that are seen to emerge from the sacral plexus are seen to innervate the muscles and also the skin around the pelvic region and also the lower limb. The sacral plexus is a network of nerve fibers that are seen to originate basically from the lumbosacral trunk. This is what is seen to be highlighted here in yellow, and also from the sacral spinal nerves from S1 to S4. And this is what is also seen to be highlighted here in red. So you see contributions from these two segments, which include the lumbosacral segment, which basically involve the L4 and L5 spinal nerves, and also the sacral spinal nerves, which include S1 to S4. These two nerves will come together to form the sacral plexus around the posterolateral part of the pelvic cavity. And branches that are seen to emerge from the sacral plexus will supply the skin and also muscles of the pelvis and also the lower limb. You see the lower limb around this region, where the head of the femur is fixed into the acetabulum. So at this region, branches that emerge from the sacral plexus will be innervating the muscles and also the skin around the pelvic cavity and also the lower limb that is close to it. So let's see how the spinal nerves emerge. We know that the spinal nerves are basically emergence from the spinal cord. Now let's use this image by the side here for illustration. Let's say this is the spinal cord, and we know that the spinal cord is embedded within the vertebral canal. This is the space that is created along the vertebral bone. So we see the spinal cord embedded within this space, and we have emergence on both sides of the spinal cord. And this emergence are referred to as rootlets. So we have rootlets emerging from both the ventral region and also the dorsal region. So in the anterior part, this is where we have the collection of rootlets that emerge from the spinal cord on one side, and this is referred to as the ventral root because it is located in the anterior part. Then behind, we also have the collection of rootlets that combine to form the dorsal root. So from the spinal cord located within the vertebral canal, within the vertebral bone, we have emergence of both the ventral root and also the dorsal root. These two roots will come together at this point to form the spinal nerve. So this is why we have the emergence of the spinal nerve, and the spinal nerve will finally divide into the ventral ramus, which is located in the anterior part, and also the dorsal ramus, which is located behind. So you see how this pattern of development occurs. But it's good for us to establish that the spinal nerve will run through the intervertebral foramen. So we have a space created here that is highlighted here in dotted red, where we have the pathway for the spinal nerve. And this is where the spinal nerve will exit the vertebral canal, where we have the spinal cord, because they need to exit this vertebral canal so that they can be able to innervate the different structures that are located outside that space. They are not needed within the vertebral canal. They are needed to create branches that will be innervating structures outside the vertebral canal. So they need to exit this space, and the only channel that is created for this is the intervertebral foramen. So you see this structure here highlighted in dotted red. So if you try to use this image down here for illustration, this is where we have the vertebral column. And we know that the vertebral column basically is made up of small pieces of bones that are arranged one on top of each other. Of course, they are joined at the intervertebral disc. So you have the vertebral bone up here, you have another one down here, while at the middle, we have the intervertebral disc joining the two vertebral bones. In between the vertebral bone, at this point that is also demarcated in dotted red, we have a space that is created, and this is referred to as the intervertebral foramen. It is through this foramen that the spinal nerve will exit the vertebral canal, where the spinal nerve will exit to supply structures outside that region. Well, this establishment is what is seen from the cervical vertebra up here down to the lumbar vertebra. But For the sacral region, it is a different scenario. The spinal nerves are seen to pass through the anterior sacral foramen. If you look at the configuration of the sacral bone, you see that the foramina are created on the anterior surface and also at the posterior surface. But when you look at the alignment of other vertebral bone, this is not the anatomical position of the vertebral bone. This is the side view, so as to be able to visualize easily the intervertebral foramen. So if this vertebral bone is directed in anatomical position, you see this intervertebral foramen on both sides, where the spinal nerves will be able to exit it on both the right side and also on the left side. But for the sacral region, the foramina are created on the anterior and also on the posterior surfaces. So you have the anterior sacral foramen harrowed here at this region, and of course it is highlighted here in dotted yellow. So you see this creating the pathway for the anterior or the ventral rami of the spinal nerve. So you see that different establishments are created between the sacral bone and the other vertebral bone. For the sacral bone, the anterior rami are seen to pass through the anterior sacral foramina, while in the upper vertebral, anterior rami are seen to pass through the intervertebral foramina. So it's good for us to be able to establish these scenarios. So talking about the specific location of where we have the sacral plexus, we already established this at the beginning of this lecture. We said that the sacral plexus is located at the posterolateral part of the pelvic wall. This is where we have the pelvic cavity. At the posterolateral part, specifically in the true or the lesser pelvis, is where we have the formation of the sacral plexus. It's good for us to establish the position of the piriformis muscle in trying to establish the specific location of the sacral plexus and also the structures that are related to it. So let's dive into the piriformis to see how it emerges and also where it is inserted upon. So for the piriformis, it emerges from the anterior surface of the sacral bone. This is where we have the sacral bone here, and this is where we have the anterior surface. So this is where we have the piriformis emerging, highlighted here in yellow, and also being inserted finally on the greater truncator of the femur. This is where we have the femur here highlighted in blue, and you see that the piriformis emerges from the anterior surface of the sacral bone, of course directed into the greater sciatic foramen, where it parts to exit the pelvic cavity, and finally coming out at this point to be inserted onto the greater truncator of the femur. So following this establishment, we now have the formation of the sacral plexus. So we have contributions from the different nerves here emerging, and from the lumbar region here is highlighted in yellow, and from the sacral region here is highlighted in red. These nerves will combine to form the sacral plexus, and you see the sacral plexus is formed on the anterior surface of the piriformis. We see that the piriformis here is on the background. Then you have the internal iliac artery and vein highlighted here in brown, and also the ureter highlighted here in black. These two structures are seen to overlap onto the formation of the sacral plexus. So we can say that the sacral plexus is sandwiched between the piriformis posteriorly and also anteriorly by the internal iliac artery and vein, and also the ureter. So this is what is presented here in this image, and it's good for us to be able to establish the relations that it has with these structures. So let's dive in to establish how the sacral plexus is formed. We say that the sacral plexus has two contributions from the lumbosacral trunk and also the sacral nerves. So let's dive in first into the lumbosacral trunk. Remember when we tried to establish how spinal nerves are formed in our previous slide, we try to establish the fact that the spinal nerve at this point will further divide into the anterior rami and also the posterior rami. So the lumbosacral trunk is formed from the anterior rami of the L4 and the L5 lumbar spinal nerves. So this is where we have L4 here at this point, and this spinal nerve will divide into the ventral ramus that is harrowed here in red, and also the dorsal ramus that is harrowed here in red, and of course formed behind. So it is from the ventral ramus of the fourth lumbar nerve that is seen to contribute to the formation of the sacral plexus. And if we have this configuration also presented inferior to it, which of course will lead to the emergence of the fifth lumbar nerve, the fifth lumbar nerve will also be contributing its anterior ramus also to the formation of the sacral plexus. So these two structures are taken as the lumbosacral trunk. We also have the anterior rami from S1 to S4 sacral spinal nerves. And of course, this will emerge at this form here, highlighted in dotted yellow from S1, S2, S3, and also S4. But it's good for us to know that these contributions are from the anterior rami of the sacral spinal nerves of this region. So all the anterior rami will come together to form the sacral plexus. It's also good for us to drive in further that there are specifications that are established in the formation of this sacral plexus. After the emergence of the anterior rami from L4 to L5 to S1, S2, S3, and S4, these anterior rami are further divided into anterior divisions and also posterior divisions. So this is where we have this emergence created at this point. Remember, at this point is where we have the anterior ramus. This anterior ramus will further be divided into anterior division that is highlighted here in blue and also posterior division that is highlighted here in red. So we have two divisions created from the anterior rami, and this is what will be the basis for the formation of the sacral plexus. So now driving into the branches that will emerge from the sacral plexus. Remember, we tried to establish that we have the spinal nerve created at this point, where of course is receiving contributions from the dorsal and the ventral spinal rootlets. These rootlets will come together at this point to form the spinal nerve. After the formation of the spinal nerve, there's going to be the division of the spinal nerve into the ventral rami and the dorsal rami. This can also be referred to as the anterior rami and also the posterior rami. So you have the anterior ramus here at this point, dividing into the anterior division and also the posterior division. So it is to these divisions that will be forming the basis for the formation of the sacral plexus. So we have branches emerging from the ventral divisions only. And if you remember, we described in our previous slide that the anterior ramus divides into the ventral and the dorsal divisions. This region here highlighted in red is the ventral division, and we have branches that emerge from just the ventral divisions of the anterior rami from L4 to S4. Then we also have branches that will emerge that are limited to only the dorsal divisions. Remember, we have the dorsal division here highlighted in blue. So we have branches that will emerge from just the dorsal divisions of the anterior rami from L4 to S4. We also have branches that will emerge from the combination of the ventral and also the dorsal divisions. So after the emergence of these branches within the pelvic cavity, this is where we have the pelvic cavity here. So you have emergence of branches from both the ventral and the dorsal divisions emerging within the pelvic cavity. Some of these branches will emerge within the pelvic cavity and supply structures within the pelvic cavity, while others will exit the pelvic cavity through the greater sciatic foramen, where they will be supplying regions around the buttocks and also the lower limb. So some will remain within the pelvic cavity, where they will be supplying structures around that space, while the others will exit the pelvic cavity, and the channel through which they exit the pelvic cavity is through the greater sciatic foramen. And after exiting it, they supply the gluteal region and also the lower limb. So it's also good for us to establish this. So let's drive it into each of these branches to see how they are formed from the ventral divisions, the dorsal divisions, and also the combinations of the ventral and the dorsal divisions. So let's take first the dorsal division. So let's look at the branches of the sacral plexus that will emerge from the dorsal divisions. So if you look at this configuration here before we drive in, this is where we have the ventral rami or the anterior rami. And the anterior rami from L4 to S4. The anterior rami further gives ventral and dorsal divisions. The ventral divisions are represented in red, while the dorsal divisions are represented in blue. So we'll be going into it to see how these branches emerge from the dorsal divisions. So the first nerve that is seen to emerge from the dorsal divisions of the anterior rami from L4 to S4 is the superior gluteal nerve. And this will emerge from dorsal divisions from L4, L5, and L1. And this is what is seen to be arrowed here in red. This nerve is seen to innervate the gluteus minimus, the gluteus medius, and also the tensor facial lata. Let's see how it parts to exit the pelvic cavity to innervate these structures, because we know that these structures are located outside the pelvic space. So when it emerges, you see it emerging at this point here, highlighted in red. You see it parting above the piriformis, where it will gain access into the greater sciatic foramen to exit the pelvic cavity. After exiting the pelvic cavity, it is directed to the gluteal region, where it will be supplying the gluteus minimus, the gluteus medius, and also the tensor facial lata. Also along the part of this superior gluteal nerve, the superior gluteal artery and also the superior gluteal vein are seen to run along with the superior gluteal nerve. We know that the superior gluteal artery is a branch of the internal iliac artery. So the second nerve is the inferior gluteal nerve. Remember, we just described the superior gluteal nerve. This is the inferior gluteal nerve. The inferior gluteal nerve is also a branch that emerged from the dorsal division. And you see it emerging from the dorsal divisions of the anterior rami of L5. This is L5, S1, this is S1, and also S2, and this is S2. So the dorsal branches from the anterior rami from L5, S1 to S2 are seen to emerge at this point, and this is referred to the inferior gluteal nerve. This inferior gluteal nerve emerges and is seen to supply or innervate the gluteus maximus. Remember, the superior gluteal nerve is seen to innervate the gluteus minimus, the gluteus medius, and also the tensor of facial lata, while the inferior gluteal nerve is seen to innervate the gluteus maximus. And this is what is seen to be arrowed here in red. Let's also see the path that the inferior gluteal nerve will run for it to be able to innervate the gluteus maximus, because we know that the gluteus maximus is located outside the pelvic space, specifically at the posterior region. So as it emerges, this is what is also highlighted here in red, it's seen to part below the piriformis, where it, of course, will gain access to the greater sciatic foramen to enter into the gluteal region. And this is where it will be supplying the gluteus maximus. If you go back to the superior gluteal nerve, you see that it parts above the piriformis because it is the superior gluteal nerve. So it's seen to run above it, while the inferior gluteal nerve is seen to part below the piriformis. It's good for us to be able to establish the path by which these two nerves run. And you also see it running along the inferior gluteal artery and also the inferior gluteal vein. The inferior gluteal artery is also a branch of the internal iliac artery. So you see that they have a kind of similarities in terms of how they run, but of course, it's good for us to establish the distinct differences that they establish in terms of the path that they run above the piriformis, which of course is for the superior gluteal nerve, and below the piriformis, which of course is for the inferior gluteal nerve. So the third nerve that emerged from the dorsal division is the nerve to the piriformis itself. Remember, the piriformis, we've used the piriformis as a landmark in establishing the position and also the relations of the sacral plexus. This is where we have the piriformis here highlighted in yellow. We also have a nerve that emerged from the sacral plexus that will innervate this muscle. It is located to the space where this sacral plexus is formed, and it's good for the sacral plexus to also give a contribution to its innervation. So we have the nerve to the piriformis emerging from the dorsal division of the anterior rami of S1 and S2. This is where we have the S1, this is where we have the S2 to form the nerve to the piriformis. And this is what is arrowed here in red. So you see this nerve providing innervation to the piriformis. So you see it emerging at this point here, also highlighted in red, and also going to innervate the piriformis. So this is one of the nerves that has seen to also emerge from the dorsal divisions of the anterior rami of the sacral plexus. So let's go to the third nerve, which is the perforating cutaneous branches. So let's see how this nerve emerge. So you see it emerging from the dorsal divisions of the anterior rami of S2 and S3. So this is where we have S2 here, and this is where we have S3 here. And you see the dorsal divisions of the anterior rami of the second and the third sacral spinal nerves. And this is where you see them coming together here at this point that is arrowed in red to form the perforating cutaneous branches. These perforating cutaneous branches will be giving sensory innervations to the skin around the lower medial buttocks. So we have the lower region, of course, directed towards the midline plane is where these perforating cutaneous branches will be supplying or innervating. So let's see how they run within the pelvic cavity after their emergence. Before we dive into this, let's try to highlight our sacrotuberous ligament. This is what is highlighted here in yellow using this lower image. We know that the sacrotuberous ligament is a ligament that transforms the lesser sciatic notch into the lesser sciatic foramen. So you have this sacrotuberous ligament connecting the tuberosity of the ischium to the sacrum. So it runs along this path. So after the emergence of this nerve from the dorsal divisions of the anterior rami of the second and the third sacral spinal nerves, you see it perforating the sacrotuberous ligament so as to exit the pelvic cavity. So after perforating it, you see it running below the gluteus maximus behind, then giving sensory innervations to the skin around the lower medial buttocks. So this is how the perforating cutaneous branches will run within the pelvic cavity and how they finally exit it to give cutaneous innervation to the lower medial buttocks. So the next branch that will be created from the dorsal division of the sacral plexus is the pelvic splanchnic nerve. The pelvic splanchnic nerve is also referred to as the nervi erugantis. And this, of course, will emerge from the dorsal divisions of the anterior rami of the S2, S3, and S4 sacral spinal nerves. So we have S2 at this point, we have S3, and we have S4. So the dorsal divisions from the anterior rami from these said branches will emerge at this point here, harrowed in red, and will be forming the pelvic splanchnic nerve. This pelvic splanchnic nerve has an interesting part or cause because as it emerges, you see it forming a contribution to the formation of another plexus, which is the inferior hypogastric plexus. So we have the inferior hypogastric plexus form around this region here, highlighted in dotted blue. And you see that the pelvic splanchnic nerve is giving a contribution to its parasympathetic outflow. And of course, branches will finally emerge from the inferior hypogastric plexus to be supplying the pelvic and also the genital organs. So now let's go to the branches that emerge from the ventral divisions of the anterior rami from L4 to S4. So the first branch here is the nerve to the quadratus femoris. This is one of the branches that would emerge from the ventral divisions of the sacral plexus. So this nerve emerged from the ventral division of the anterior rami from L4, L5, and S1. So this is where we have L4, this is where we have L5, and this is where we have S1. So as they emerge here, they come together at this point to form the nerve to the quadratus femoris. So this nerve basically supplies the corresponding named muscle and of course the inferior gemellus muscle. So if you use this image down here for illustration, this is where we have the piriformis. If you remember, the piriformis muscle is what we use to establish the landmark of how the sacral plexus is positioned. Then inferior to it, we have the obliterator internus. Inferior to the obliterator internus, we have a four-sided muscle that is referred to as the quadratus femoris. This quadratus femoris is what is innervated by the nerve to the quadratus femoris. Just its corresponding named nerve. It also gives supply to the inferior gemellus muscle. And this is what is harrowed here in black. This muscle has a superior part that is located above the obliterator internus. Muscles captured within this region here in dotted yellow are innervated by the nerve to the quadratus femoris, which include the quadratus femoris itself and also the inferior gemellus muscle. Then the next is the nerve to the obliterator internus. The nerve to the obliterator internus are also emergent from the ventral divisions of the anterior rami of the sacral plexus. And they emerge from the ventral divisions of the anterior rami of L5, S1, and S2. And at this point is where they emerge, that is harrowed here in yellow. And they, of course, they innervate the obliterator internus and also the superior gemellus muscle. Remember, the inferior gemellus muscle is innervated by the nerve to the quadratus femoris. So the superior gemellus muscle is innervated by the nerve to the obliterator internus. Let's go back to this image down here for our illustration. This is where we have the piriformis, as we highlighted before. Then inferior to it, we have the obliterator internus. Then superior to the obliterator internus, we have the superior gemellus muscle. And this muscle here, and also the obliterator internus, are innervated by the nerve to the obliterator internus. And this is what is captured here in dotted yellow. Remember, we have the inferior gemellus muscle here at the inferior part of the obliterator internus. And this is supplied by the nerve to the quadratus femoris, which of course is also located close to it. So you see that the innervations are given based on their positions. So we have muscles that are closely related to it. They also try to enjoy the innervations of those muscles. Then the next is the pudendal nerve. The pudendal nerve is also a nerve that emerges from the ventral divisions of the anterior rami of the sacral plexus. And they are seen to emerge from the ventral divisions of the anterior rami of the second, the third, and also the fourth sacral spinal nerves. And this is where they emerge at this point. This is where we have the second sacral spinal nerve. This is the third. This is the fourth. So you have the anterior or the ventral divisions of the anterior rami of the S2, S3, and S4 emerging at this point here, carried in yellow as the pudendal nerve. So let's see the cause of the pudendal nerve. The pudendal nerve leaves the pelvis through the greater sciatic foramen, and they also re-enter back through the lesser sciatic foramen. And after re-entering the pelvic cavity, you see that they run within the pudendal canal. This pudendal canal is also referred to as the Alcock's canal, and it is a tunnel or a canal that is formed by the fascia of the obliterator internus. So if you look at this region here, this is where we have the pudendal nerve here, arrowed in yellow. The pudendal nerve, upon it re-entering into the pelvic cavity, you see it running within this canal that is highlighted here in dotted red. And this canal, we say, is formed by the fascia of the obliterator internus. And this is where you see it running and patting along this canal. It does not pat along this canal alone. It is seen to pat along with the internal pudendal artery and also the internal pudendal vein. So you see a number of structures within the pudendal canal. So you see this nerve giving branches within the canal and also after exiting it. And they give supply to the levator ani muscle and also the external anal and urethral sphincters. They are also seen to supply the skin of the perineum and also the penis in male and also the clitoris in female. So the next nerve is the nerve to the levator ani and also the coccygeus muscle. This nerve is one of the emergence of the ventral divisions of the anterior rami of the sacral plexus. And you see it emerging from ventral division of S3 and S4. This is where we have S3 at this point, and this is where we have S4. So you see the ventral division of the anterior rami of S3 and S4 coming together at this point that is harrowed here in yellow to form the nerve to the levator ani and also the coccygeus. Remember in our previous slide where we described the pudendal nerve, we said that the pudendal nerve also gives innervation to the levator ani muscle. So this nerve is also seen to also support in the innervation of the levator ani muscle and also giving innervation to the coccygeus muscle. So the next are the branches of the sacral plexus that will emerge from contribution from both the ventral and also the dorsal divisions. So let's dive into this to see the nerves that will emerge from contribution from both the ventral and the dorsal divisions. The first one is the posterior femoral cutaneous nerve. The posterior femoral cutaneous nerve can also be referred to as the posterior cutaneous nerve of the thigh. So we should know by now the specific region that this nerve will be giving cutaneous innervations to. Will definitely be supplying the posterior region of the thigh. And we say that this nerve has contribution from both the ventral division and also the dorsal divisions. Remember, we've been describing branches that emerge solely from the ventral and also the dorsal. But for now, we'll be describing the branches that will emerge, receiving contribution from both the ventral and the dorsal division. Of course, the posterior femoral cutaneous nerve is one of these branches. And you see it emerging from the ventral division of S2 and S3. And this is where we have the division division here, harrowed in green, we have S2 and we have S3. So as they emerge at this point, they are forming a contributory branch to the formation of the posterior femoral cutaneous nerve. And we also have dorsal divisions from S1 and S2. So this is where we have the dorsal division here, harrowed in purple. So we have from S1 and S2 coming together at this point to also form a contributory branch to the posterior femoral cutaneous nerve. So at this point, the two branches will merge to form the posterior femoral cutaneous nerve. And if you see the establishment of the posterior femoral cutaneous nerve, you see that it has contributory branch from the ventral division and also the dorsal division. And after the emergence of this nerve here, highlighted in red, the part below the piriformis, where they will be able to gain access into the greater sciatic foramen to exit the pelvic cavity, innervating the posterior region of the thigh. Also giving contribution to innervate the posterior lower part of the buttock and also the posterior region of the knee. Then going to the last nerve, which is the sciatic nerve. This sciatic nerve is also a branch that emerged from contribution from both the ventral and also the dorsal divisions. Remember, we just described the posterior cutaneous nerve of the thigh, which has the same pattern of formation with the sciatic nerve. So let's see how the sciatic nerve is formed from both the ventral and the dorsal divisions of the sacral plexus. Sciatic nerve, we already said that it's like a two-in-one nerve, judging by how it emerges. It is, as a matter of fact, it is the largest branch that is formed from the sacral plexus. It is about 2 cm in thickness. So you have one sub-branch coming from the ventral division, and we have another sub-branch coming from the dorsal division, which of course will unite to now form the sciatic nerve. So let's see how they emerge. So from the ventral divisions, we have these divisions running from the anterior rami of L4, L5, S1, S2, and also S3. And at this point here, arrowed in green, is where they emerge as a sub-branch of the ventral divisions. And this, of course, will be forming the tibial nerve. So we should look forward to this as we go through with the sciatic nerve. The second subcomponent of the sciatic nerve will emerge from the dorsal division. And this will emerge from the anterior rami of L4, L5, S1, and S2 of the spinal nerve. And this is what is harrowed here in purple. And this will later become the common fibular nerve. So we should also look forward to this as we look through the sciatic nerve. So the branches that emerge from the ventral division and the dorsal division at this point, harrowed in black, will unite to then form the sciatic nerve, having contribution from both the ventral division and also the dorsal division. The sciatic nerve, after its emergence, you see it running through the greater sciatic foramen, because this sciatic nerve will supply muscles and skin around the lower limb. Definitely it needs to exit the pelvic cavity. So after its formation, it runs through the greater sciatic foramen and it descends along the posterior part of the lower limb. So this is the sciatic nerve. And if you use this image besides here, as it descends down around the apex of the popliteal fossa or the superior border of the popliteal fossa, you see it divided into the two major branches that it is made up of. So you see it divided into a larger tibial nerve. And this is the larger tibial nerve here on this part here that is harrowed in red, and also a smaller common fibular nerve or a common peroneal nerve. And this is what is also harrowed here at this point. So you see that the sciatic nerve will further divide into the tibial nerve and also the common fibular nerve. So as they divide, they will be giving motor and sensory innervations to different regions of the lower limb. For the tibial nerve that emerges at this point, we'll be giving motor innervations to the muscles around the posterior part of the thigh, the posterior part of the leg, and also some intrinsic muscles of the foot. It will also be giving sensory innervations to the bulk of the sole. The common fibular nerve or the common peroneal nerve will be giving also motor innervations to the muscles that are located at the lateral and also the anterior part of the leg, and also some intrinsic muscles of the foot. It will also be giving sensory innervations to the bulk of the dorsum of the foot. So you see how the tibia and the common fibular nerve are taking specific regions within the lower limb to give motor and also sensory innervations. Let's go to the clinical anatomy. Damage to the sacral plexus. Damage to the sacral plexus will lead to the loss of actions of the muscles that are involved. We've tried to highlight different branches from the sacral plexus and also establish the different muscles that these branches innervate. So if there is a damage to the sacral plexus, and if this damage is specific to a region, it's going to be affecting the muscles that these nerves innervate. Then we could have damage to the tibial nerve. Damage to the tibial nerve basically will lead to the inability to plantar flex, because most of the muscles that the tibial nerve innervates are located at the posterior part of the lower limb, and these muscles are responsible for plantar flexion. Then the third one is damage to the fibular nerve. Damage to the fibular nerve will lead to the inability to dorsiflex, which will lead to foot drop. So let's look at this question, and this states that we should list the branches that emerge from the dorsal divisions of the anterior rami of the sacral plexus. The second question is to list also the branches that emerge from the ventral divisions of the sacral plexus. And the last question is to list the branches that emerge from both the ventral and dorsal divisions of the sacral plexus. So thanks for watching this video. Let's continue to stay glued to this channel.